Memo to staff seen by Channel 4 News. It shows the level of pressure some hospitals across the country are already under. The memo says there has been a significant rise in the numbers of patients being admitted and also how sick they are.
I think I should be honest with you all in saying that this has been a distressing weekend for many of our staff on the front line, as people have been coming in through the door sick and have deteriorated at an alarming rate. Whilst it's fair to say that most of the patients who have died probably would have died from the flu or any other major infective illness, the volume of patients in this situation is unprecedented.
Today saw the highest jump in deaths so far, much of it still centred on London. Between Friday and today, 21 were at London North West Trust, which includes Northwick Park, the hospital that last week declared a critical alert after running out of beds. An intensive care specialist in the north of England told us today that they were watching and waiting.
We've been seeing the COVID pandemic kind of explode in London because I'm up in the northwest of England. We're about several days behind, I think. We're anticipating it getting worse in Manchester before it comes to our neck of the woods. However, we're already starting to see patients come in, and we're already having to start implementing expansion plan after expansion plan.
Lest we forget, this is still winter and patients are also ill with other conditions. Wales illustrating this. 45% of their critical care units are occupied. 15% of the patients are suspected or confirmed COVID-19 cases. A survey by the HSJ Journal reveals that 13 trusts in England have warned they will run out of intensive care beds next week. This trust said, huge surge in London and we will run out of staff because of self-isolation, plus some staff now sick. We will run out of ventilators later. And on personal protection equipment, a Midlands hospital said PPE shortages, fitful and inconsistent delivery, combined with a near revolt amongst my clinical staff about the national guidance on use of surgical masks for non-aerosol generating work. These pictures show the Army delivering equipment this morning and the Health Secretary promising more to come later.
Having the protective equipment for the staff on the front line, especially in the NHS and social care, but also in other frontline services, is very important. We are moving heaven and earth, as he asks, and the military involvement is ramping up the delivery of that equipment.
The race is on to find a tracking app. They were used in China and can help with contact tracing, who you've been in touch with if you've been infected.
Report symptoms.
Today, King's College launched their own app.
I'm not feeling quite right. And then it goes down through not just the persistent cough, but unusual fatigue, unusual shortness of breath, loss of smell, taste, unusually hoarse voice, unusual chest pain or tightness.
We can look at hotspots, we can see trends emerging, we can see how fast things are spreading, and we can see whether there are high-risk areas.
The aim is to fill in what many see as a critical gap in the knowledge of COVID-19. How many people don't ever have symptoms? If they do, what are those symptoms precisely? And how many people have already been infected?
Well, joining me now via the internet is Hugh Montgomery, who's Professor of Intensive Care Medicine at University College London. Professor, we've seen the highest UK deaths in a single day. Do you fear that we're heading for the kind of scale of suffering that we've seen in Italy?
Regrettably, the answer has to be yes. And the reason for that is the simple mathematics of doubling. And this has been explained before, but if you assume, at the worst case, that every person with the disease can infect 3 more, by the time each of those has infected people and gone out to the 9th or 10th cycle, you're knocking somewhere in the region of upwards of 55,000, 60,000 people infected. And people were socially engaged with each other until only yesterday with the lockdown. We still saw these completely crazy mass gatherings at the weekend. 6 days of incubation, 6 to 10 days before people hit intensive care units, and then time on intensive care units before they die. So this death rate is going to go up steeply. Intensive care bed use is going to go up steeply, and it's going to follow the same trajectory as the disease infection rate did 10 days or so ago when it suddenly took that uptick.
Well, you work in intensive care at a hospital in North London. We've had this warning from 13 trusts that they'll run out of intensive care capacity next week. How are you doing?
Well, at the moment we're doing well, and I have to say the NHS, you know, particularly people who work in critical care, emergency medicine, and so forth, are cut of a cloth that it makes them somewhat more resilient than others, perhaps, because they've chosen that path. We've done our best. These are extraordinary times, and we are certainly coping at the moment with the patients we have. But I have no doubt at all that we will be unable to cope. And that's not because people haven't tried or because government hasn't tried. It's just the mathematics of the speed of the rise. So I would expect we're seeing doublings of cases, which means we're now seeing doubling of ITU admissions. And if you can do your own maths, if you imagine there might be more than a couple of hundred people on ventilators now or in intensive care in Britain, I don't know the precise number this evening, but it will be somewhere upwards of 200-300, I guess. If you imagine that doubles in 2 days, and then that doubles again in 2 days, and that doubles again in 2 days, and it will keep doing that until these impacts of social isolation bite and start flattening this curve, flattening the rise. So we're in for a tsunami of cases in the next fortnight.
And so at what point do you estimate that you will run out of capacity at your hospital, the Whittington?
We've had a benign rise at the moment. Probably inappropriate for me to tell you quite where we are clinically. We're better than some in London. Maybe that's because people socially isolate more, I don't know. But either way, we're slightly better off. But at the moment, the doubling rate, we would be likely, like many other trusts actually in London, to be out of beds by the end of the weekend.
I mean, that's very soon. That's extraordinary. What will you do then at that point?
Well, we're all trying to do our best at the moment to come up with management plans that can perhaps help mitigate people coming to intensive care at all. So the first thing, which sounds harsh, but is not meant to be, is just the conversations with your frail and elderly family, or if that is you, about what is appropriate for you when you become critically unwell. And this is something we planned as a Intensive Care Society nationally, is to have a conversation with people nationally this year about it. It's not just about coronavirus, but it does bring it into focus. That's not rationing. That's not the question of saying if you're old, we're not interested in you. Not at all. But it's just to say, if life is coming to an end naturally anyway, maybe the way that your life ends shouldn't be on an intensive care unit. The second thing, though, is that we're trying to learn from our colleagues in Italy and China and elsewhere about the best ways to manage people without going onto ventilators. And there are some tricks of the trade that seem to be effective, and we have care pathways to try to do that too. But no, I mean, we've never been here before, and people are going to have to be inventive, and the work is going to be very, very hard.
Does this new XL Centre, opening up 4,000 beds that the Health Secretary has been talking about, does that give you hope?
I don't know. And being honest, I don't think there's any option except to do that, because we are going to run out of beds. So unless we create massive capacity somewhere, somehow, we're not going to be able to cope with the patients. It makes sense to me to put those people in one place as much as one can, because perhaps cohorting patients allows more effective use of staff and more efficiency. But this is a matter of an enormous scale. I mean, a hospital requires staff, accommodation, food, beds, drugs, pharmacies, oxygen, ventilators. This is an industrial scale to achieve. I do know one or two of the people involved in the clinical leadership of that, and they are exceptional. So if it can be done, they will do it. I have no doubt. These are good people.
And just finally, we've seen people lighting barbecues, you've got people going to construction sites. What do you say to them as someone who is working on the front line right now trying to save people's lives?
Do you know, I've lost my temper now. I, as you may know, gave an interview for Dispatches for Channel 4 a week ago, and I was trying to be polite to encourage people to do the right thing. But this is criminal, and it is not about you. If you're a young person who is reasonably healthy, the odds are overwhelmingly in your favour that you will only get mild disease. But if you pass it on to other people, doing those maths within 10 cycles, and you pass that on, and you've infected 60,000 people, and 1 in 10 of those comes to an intensive care unit. There are only, or were only, 1,000 intensive care adult beds in this country, and you will have caused a tsunami that will engulf that on your own. For goodness sake, stop. Stop doing this. It's wrong.
Professor Hugh Montgomery, thank you so much for joining us. Well, the Army stepped in today to deliver personal protective equipment to hospitals across the UK after NHS staff repeatedly called for better supplies of gloves, masks and gowns. Our North of England correspondent Claire Fallon has been speaking to one nurse who works in an intensive care unit. She paints a bleak picture of the situation inside hospitals, and she fears the situation could get worse.
Protect the NHS is the message. Lorraine works for the NHS. She's a nurse in intensive care, and she doesn't feel protected.
If we go down, nobody's going to look after you. Nobody. And I am, this is a tsunami waiting to happen. We are just preempting a tsunami at the minute, which will come in the next couple of weeks.
You're really scared, aren't you?
Yeah, I am really scared. I'm really scared, and I'm willing to be in work. I want to be in work. I'm not a hero. We're not heroes. This is our job, but we signed up for it with a promise that our government would look after the staff, and you're not looking after the staff.
Lorraine works at a hospital in Greater Manchester. She doesn't have permission to do this interview, but felt she had to speak out. Despite assurances from the Health Secretary that there is enough protective equipment, she told me that's not the experience of staff at her hospital.
I want to save people's lives, but I want Matt Hancock to realise that we have not got enough equipment, and we need the equipment now. A week ago, we were asked to share masks, this type of a mask.
So that one your husband's?
This is my husband's, which I will hopefully be able to use when I return back to work.
To be clear, he doesn't work in the NHS?
No, he works in pest control. But what I'm concerned about now is the sharing of filters, because they will hold bacteria. The trust where I work have done everything they possibly can to prevent this, and we are willing to share masks. That's what gets me, is that we are willing to put our own lives at risk to share filters and to share masks, but it's not acceptable.
To get more personal protective equipment into hospitals, this nurse says the government should be asking private companies what stock they have in case it can be used. For now, she will keep on working, risking her own life to save others. How worried is your husband about you?
For the past week, Keith's been waking up every morning telling me how scared he is. I've not been scared, funny enough, until today. But my husband's been very, very scared, and every morning when we've woke up, he said to me, just keep safe.
We did ask the Department of Health to respond, and they said we're working round the clock to make sure trucks are on the ground across the country delivering protective equipment to all who need it, so they are well equipped to continue to fight the virus. Well, joining me now is Chris Hobson, who leads NHS Providers, the group which represents every hospital and health service trust in England. Just first, we just heard from an intensive care nurse there who said that she'd been asked to share a mask. Does the NHS have enough personal protective equipment now or not?
So nothing could be more important than ensuring that the frontline staff on who we're going to rely so heavily over the next few weeks have got the right equipment. What the national leaders tell us is that there are sufficient stocks of the required supplies. The issue, as we've talked about a couple of times before, Kathy, is that actually we've had a distribution problem in terms of getting those supplies to where they need to get to.
Yes, but we have talked about that a couple of times, and I'm just astonished that we're still hearing from the nurse we've just heard from that this is still a problem. Does that astonish you? Does it anger you?
Well, so all I can judge on, Kathy, is the fact that we have an ongoing, literally hour-by-hour dialogue with our 233 trust chief executives. And 3 or 4 days ago, there was huge levels of concern around the fact that the distribution was not getting through. All I can measure, and I've got a national picture as opposed to an individual staff member picture, is that the number of chief executives who are saying to us that the supplies are coming through is growing. We still, and it's growing very rapidly, we still got a small number who are saying that the distribution isn't quite there yet. So what we're seeing is a very rapidly improving position. We know that the Army has now been involved. We know that national logistics companies have been involved. And what we've said is it's really vital that improvement continues.
Well, when can you promise staff that they'll have all the protective equipment that they need? How soon?
Well, I'm not a national leader, Kathy, as you very correctly said when you introduced me. I'm the representative of the trusts. What we're saying to national leaders is it's incredibly important that all staff have access to the equipment that they need.
OK, and obviously the reason for that is that NHS staff are falling ill because they don't have the proper equipment. How many NHS staff do you believe are currently ill?
Again, that's not a question I can answer because I don't have the information. I'm not, as I said, I don't work for NHS England. I'm a representative of the trust. All I can tell you is that in the conversations we have with our trust chief executives, they're saying that it is absolutely fundamental that we, in order to rely on the clinicians who are doing all of the work that you've heard about, both from that nurse but also from Professor Montgomery, is that the equipment is there when it's needed. And we know the national teams have been working incredibly hard to make that happen. And clearly, it's not acceptable if there are places where the equipment isn't there. But we know there's huge amounts of work being done to make sure that that equipment is where it needs to be, when it needs to be.
Chris Hopton, thanks very much for joining us.